Today we will be performing a simple dry dressing change. To begin this assessment, the student will first start by performing hand hygiene, introducing themselves, identifying the patient with 2 identifiers, providing them privacy, and explaining the procedure and gathering their equipment. Then they will assess the patient's history of any allergies.
Good morning, Mrs. Nightingale. My name is Kate. I'm going to be your nurse today. How are you feeling this morning? All right. Can you go ahead and tell me your name and date of birth? Florence Nightingale, 10/17/1958. Okay. Are you allergic to anything? You're allergic to penicillin? Okay, we won't be working with any penicillin today. I went ahead and shut the door already to give us some privacy. Today I'm going to be doing a simple dry dressing change on your abdomen, and I already have my equipment here gathered. Are you ready to get started? Great, let's get started.
You are now going to position the patient bedside table at an appropriate working height and ensure proper body mechanics. You will then review dressing change orders.
Okay, I'm reviewing my orders, and I have orders from the physician, and then we are ready to get started.
Okay. You are now going to assess risk for delayed wound healing and assess for pain.
Ms. Nightingale, before we get started, are you having any pain today? No, you're feeling okay? All right, well, just let me know if that changes. And then do you have a history of smoking? Nope, never smoker? Okay. Any history of uncontrolled diabetes? Nope, no diabetes? Okay, wonderful. And can you tell me a little bit about your diet? Are you having high protein and fruits and vegetables? You are? Wonderful. Okay, so all those things factor into how well your wound is going to heal. So it sounds like you're on the right track.
You are now going to don clean gloves and expose the patient's wound only.
All right, Mrs. Nightingale, I'm just going to put on some gloves, and then we're going to get started with this wound.
So remove tape gently. Remove soil dressing by folding it with the drainage inside. You are now going to verbalize the inspection of site for any signs of infection.
All right, so I'm just going to remove this dressing. All right, so I'm just going to inspect the wound and also inspect the dressing. First, I'm going to assess for any temperature, any warmth around the wound. I don't detect any. I don't see any drainage on the bandage itself or coming out of the wound. The color of the wound looks a nice pink color, and the edges are well approximated. And I don't have any odors that I smell. So I'm going to go ahead and dispose of this in the biohazard bag, and I'm going to wash my hands.
Next, take measurements of wound. Always compare the current wound assessment with the previous assessment to determine wound healing.
All right, Mrs. Nightingale, we're just going to quickly measure that wound before we redress it. So that's about 7 centimeters, and the edges are well approximated, so there's no depth or width, or depth to measure. And I'm going to go ahead and compare that to the previous measurement that was taken by the last shift to see how we're doing with wound healing.
Next, open sterile supplies, maintaining a sterile border.
That one tore. So let me grab a new one.
Now, lip saline. Use an aseptic technique to moisten sterile gauze with the prescribed solution. Then you're going to wash your hands, then don clean gloves. Now we're going to clean the site from area of least contaminated, which is the incision or center of wound, to the outside, to the most contaminated, which is the outside of incision, to the surrounding skin. We are going to maintain sterility when applying a dry dressing. Next, you're going to remove your gloves without contaminating yourself, perform hand hygiene, and don new clean gloves. You're going to secure with tape, label your dressing with your date and time and initials.
Okay, Mrs. Nightingale, we are almost done. I'm just going to secure that dressing. Are you doing okay? All right. We are all finished, Mrs. Nightingale. If there's anything else I can get you before I go, you're okay? All right, here's your call bell light. I will be back to check on you in 15 minutes, okay?